The federal government says about 162,060 hypertension cases were diagnosed as at April 18, 2023, under the National Hypertension Control Initiative. The Minister of Health, Dr. Osage Nharinire, who disclosed this at a press briefing on Wednesday to commemorate the World Hypertension Day, added that over 1 million episodes of blood pressure checks were conducted in 2022, while 43,000 new cases were detected. The report.
The burden of hypertension has been disproportionately more in low and middle-income countries in recent decades, with Nigeria making up the list of countries burdened by cases. This is due to the increase in the prevalence of risk factors such as tobacco use, physical inactivity, unhealthy diet, and harmful alcohol consumption.
In Nigeria, hypertension is a major public health challenge as it is the #1 non-communicable disease. It is estimated about 28 million Nigerians are living with hypertension, and more than half are undiagnosed because most people are unaware that their BP is elevated. As a result, they are likely to present at a health facility only when complications set in.
The Minister of Health, Osage Nharinire, who was represented by the Director of Public Health, Dr. Alex Oko, stressed that the significant burden is further worsened by the high proportion of persons that are unaware of their conditions, putting them at risk of avoidable medical complications and death.
That public awareness creation, education, routine screening at every opportunity, early detection and diagnosis, counseling and prompt provision of standard treatment and care are essential elements for hypertension prevention and control. Otherwise, hypertension can lead to fatal complications such as heart disease, heart failure, stroke, blindness, chronic kidney failure, and dementia.
As part of efforts to curb its prevalence, in 2019, the Federal Ministry of Health, in collaboration with the National Primary Healthcare Development Agency, the World Health Organization Country Office, and Resolve to Save Lives, launched the National Hypertension Control Initiative with the main objective of strengthening public health centers to provide hypertension services such as awareness creation, education, screening, early detection, quality treatment, care and support, including referral. The initiative, according to the minister, improved the blood pressure control rate from less than 20% at the start of the project to almost 30%.
In response to the high burden of hypertension in Nigeria, the federal government over the years had instituted several strategic interventions at the tertiary, secondary, and primary healthcare levels with the target of screening at least 80% of the eligible population and placing 80% of people with hypertension.
The Healthy Heart Africa program that was launched in August 2022 included additional public health centers to provide hypertension prevention, treatment and care services under the program. But experts say adequate control measures must be put in place to reduce the burden of cardiovascular diseases in the country. Aisha Salihu, Trust TV News, Abuja.